Okay, you're good to go.
All right, thank you. Yeah, just wanted to remind everyone that we're being live streamed on the county YouTube channel and being recorded. So, as I said, we're still expecting a few folks to join us, but we'll get started. I think we could start with the minutes. Anyone want to make a motion for the minutes? Tom, in a second, Paula. Okay, any discussion about them? Corrections?
I didn't see any.
Okay, so all in favor of accepting them as we've received them? Okay. Thanks, everybody. Any privilege of the floor? All right, how about any announcements? All right, okay, thank you. So as far as my report goes, we may have another guest join us for someone else, an additional applicant for our current opening on the board. So we'll see if she joins us. If she does, we'll introduce her and give her a chance to talk about her interest. And I'm glad Beth is here today again too. Thank you, Beth. All right, so we could quickly go into Elise's presentation. Elise and I talked briefly about learning more about employment options. We had a conversation at the board meeting last month about some of the changes that may be happening through Challenge, and it was an opportunity for us to become more informed about what different trends are in employment options for folks. And Elise has an expertise in that area and has offered to present information to us so that we can have a more complete background about what's happening in that field. So I'm really glad you could do that, Elise. Thank you.
Yeah, thanks. No problem. And I'm going to try to share my screen. And I'm going to go camera off while I'm talking. Those of you who know me know I have a pretty significant problem with my neck, and my neck I'm having a bad neck day. So I'm going to go camera off. It'll make it easier for me. Okay. Okay. And are you seeing my slides, or are you seeing my note slides?
We're seeing your slides, I'd say.
Slides, okay.
All right, very good. Okay, so thanks for that setup, Mary. That pretty much encapsulates it. I just thought it would be a nice idea to sort of ground us all as a board in some of the foundational aspects of the landscape of employment supports as they exist today. It's a field, it's interesting, it's a field where a lot has changed and almost nothing has changed at the same time. So there's sort of a never-ending change in terms of funding mechanisms and the types of supports that people receive, but at the same time, the employment rate of people with significant disabilities really hasn't changed much. So I just thought that we could all start with a foundational understanding of employment of people with disabilities. And the most foundational understanding of that is that employment is a social determinant of health and well-being for all people, including people with disabilities. So I point this out to say that I think, we need to approach any conversations we have as a board coming up, regarding any changes to supports and services in Tompkins County from a perspective that employment is a need to do, not a nice to do. So, obviously it's really important to the financial well-being of people. It creates an opportunity for social interdependence. It creates increased access to healthcare, meaningful days and a purposeful life, which is something that we all derive from work, and of course, opportunities for greater community inclusion. So I just wanted to state those as sort of like a shared understanding for moving forward. The other thing I wanted to make everyone aware of, if you don't already know, is that New York is what's called an employment first state. And I included on this slide the definition of employment first from the State Employment First Leadership Network, which is a project of the Institute for Community Inclusion at UMass Boston. So they define employment first as a state level approach to disability services. It means that employment is considered the option of choice for citizens with disabilities, rather than placement in a sheltered workshop, a day habilitation program, or another segregated or non-inclusive setting. And I'm going to get into that in a couple of minutes in terms of exactly what does that mean? What does that look like in terms of employment supports in segregated and non-inclusive settings? I'll also mention I have a resources slide at the end of this PowerPoint where I do include the link to the New York State Employment First Commission's report if anyone's interested. And they had outlined a set of, I believe, 11 policy and practice goals for the state of New York related to employment first several years ago. So in general, in terms of the policy landscape that relates to employment services for people with disabilities, there are a lot of different legislative actions, rules and statutes that are designed to address the needs of people with significant barriers to employment. So those statutes authorize services, define services, and fund services for job seekers with significant disabilities. So job seekers with disabilities are really served across a lot of different systems. And I won't get into, so within those different systems, there are a multitude of funding mechanisms and types of services with different scope aimed at different populations, which I can't even begin to touch this evening. So I'm just going to paint with a really broad brush. But in general, state developmental disabilities and mental health agencies have a variety of different types of programs that are created for employment support services. Of course, the biggie is state vocational rehabilitation agencies. In New York State, that's referred to as Access VR. Also, the state workforce development system serves job seekers with disabilities as mandated by law. And all of that trickles down to community-based organizations. In particular, in New York State, in some states, state VR agencies actually have VR counselors that have their own caseloads and provide direct supports to individuals. In New York State, most of that work is contracted out to community-based agencies. And so and we'll get into that in a moment, a lot of community-based agencies have contracts with VR. So the other important thing to know about employment supports is that participants are made eligible for them, but are not entitled to them. So within all of these different agencies that may offer different types of employment supports, there will be a process of eligibility for each. This is a little graphic that just sort of depicts this. It's something that I swiped from a manual for those of you who are familiar with the old RSC task network and the special education system. Region 9 had this nice little graphic in their manual on community-based services. So it just shows you here the flow from state agencies to providers of those types of supports and services. So you can see that there are a number of individuals who do this on a for-profit basis as private contractors. So for example, there are such things as freelance job developers, although I am not certain how many are operating within Tompkins County. So there are people who do private assessments, private rehab agencies, et cetera. There are private non-for-profit organizations, which is your traditional community rehabilitation program or community-based agency. And then there are other sources of employment supports in communities. So schools do a lot of employment support services, in particular students with IEPs are required to receive transition services under IDEA. Churches, community centers, and of course, centers for independent living, which are another type of community-based agencies, all provide employment supports. And you could add, clinic services, right? So in Tompkins County, I believe the PROS is operated out of the clinic, if I'm not mistaken. So there's a lot of different ways that people can access employment supports. So there are some choices in terms of what agencies can provide. So not all agencies provide all things. And this is sort of where we are at this point in time in Tompkins County. And so really our goal in Tompkins County is to make sure that there is a robust array of employment supports that will serve people with disabilities regardless of disability type. So that's very important. So it's very common for agencies that provide services to people with disabilities to have contracts with Access VR or with the New York State Commission for the Blind. So in New York State, we have a dual VR agency. We have a separate VR system for people who are blind. And then we have another VR agency, Access VR. So a lot of agencies have contracts to provide job placement, job coaching, and what's called follow-along supports to individuals with a variety of disability types. They just have to be made eligible for Access VR. In addition, in New York State, the Office for People with Developmental Disabilities has a variety of mechanisms to fund employment supports to people who are OPWDD eligible. So that is, that's a catch there. So a lot of agencies have contracts to provide the same types of job placement, coaching, and follow-along supports. Again, there's different mechanisms for that, different funding vehicles with different rules and regulations and parameters of service. But a lot of agencies have those contracts to serve people through OPWDD. And then a lot of agencies have pre-vote contracts. I am not super up to date on the status of pre-vocational service delivery, but primarily would be a community-based pre-vocational experience, and often that is a non-paid pre-vocational experience of some type. It's really about pre-vocational goal development. So then on top of that, you'll have some agencies that offer services such as competitive placement, which is a less intensive support to help people find employment. Ticket to Work for those who receive Social Security benefits and want to assign their ticket to what's called an employment network. They are able to participate in the Ticket to Work program. We do have that here in Tompkins County. Some agencies offer job clubs for recipients of temporary aid to needy families. I am not sure at this point in time what the status of that is in this county. And then some agencies, and I put this in the some category because unfortunately, not all disability service providers who do employment provide services for people with a primary MH diagnosis. And that by that, I mean comprehensive job placement, job coaching, and follow-along services. And the reason behind that is that historically, it has not always been, agencies have not always been able to provide that at a break-even point. Sometimes it's a money loser, unfortunately. And then increasingly some agencies, although unfortunately not at this point in Tompkins County, some agencies provide what's called pre-employment transition services to students with disabilities. And that's for those who are eligible for vocational rehabilitation or potentially eligible. And I could talk about pre-ETs for a long, long time. We can't get into it tonight, but unfortunately that is not a service that's currently available in Tompkins County. It is available, I shouldn't say that, it's not available in its entirety in Tompkins County. So there are parts of it that are available. So there's a really important distinction when you're talking about the different ways that people receive employment services, in terms of whether they could be considered integrated opportunities or non-integrated opportunities. So on these two columns here, I have a list of types of scenarios that may usually be integrated or usually non-integrated. And the reason why I emphasize the usually here is because a lot of it has to do with the way in which these opportunities are structured. So a service that's, usually non-integrated can sometimes be structured in a way that's integrated, and vice versa. Something that's usually integrated could be structured in a way that makes it non-integrated, which I realize is confusing, but that's the world of employment services. It can be quite confusing. So usually an integrated employment service results in competitive integrated employment. That means that it is a job that has been competed and that exists in the community. It's a one person, one job kind of model. Some agencies have social enterprises, which if implemented effectively, provide a source of revenue and also an employment opportunity for people being served. I say that some social enterprises are integrated because honestly, not all are. It depends on how they're designed. And some work-based learning opportunities. So work-based learning opportunities could occur, for example, in the workforce development system. They could occur in schools. They could occur through the use of pre-vocational funding through OPWDD. So there's a lot of different scenarios, but ideally work-based learning occurs in real workplaces. So ideally those experiences are integrated. There's a few models of service that are common and are usually non-integrated. So enclaves, which are more recently referred to as contract services, are often not integrated. So that's important to know. So this would be a model where you have sort of a pod of employees that travel to a work site that are supervised by agency staff. They work together with other people with disabilities and the staff of the agency. And so those would not be truly integrated in many cases, although sometimes they are. Again, it depends on how they're structured. So another thing that's commonly not integrated would be manufacturing opportunities. So those types of services and supports typically occur in workshop settings. So that would be, what you would think of as the traditional sheltered workshop in many cases. Often pre-vocational services are not integrated. It really depends on how they're structured. They could be integrated in the community in a manner that provides real world workplace work experiences, but often they are not. And again, examples from the school-based enterprises are not usually integrated. So that could be something that the school develops to provide work-based learning experiences for students in the building. It would typically be something like a snack cart run by students with disabilities. So those are some examples of usually integrated and usually non-integrated models of employment services. So in 2014, the Workforce Innovation and Opportunity Act replaced WIOA, so it replaced the Workforce Investment Act, and it did some very important things. It did a lot more important things than appear on this slide, but for the purposes of this conversation. So it amended Title I of the Rehabilitation Act of 1973, and the Rehabilitation Act, Title I of the Rehabilitation Act is what authorizes vocational rehabilitation funding to states. And in doing so, it established for the very first time a statutory definition of what comprises competitive integrated employment, or CIE, of a person with a disability. The other thing it did was it limited the ability to place young people in settings where they would be making sub-minimum wages. It did not amend the Fair Labor Standards Act, so it didn't get rid of sub-minimum wage. And for those of you who don't know, it is possible for an agency or an employer to apply for a special certificate with the Department of Labor under Section 14C of the Fair Labor Standards Act, and in certain circumstances, pay people with disabilities less than the minimum wage. So this would typically have been the case in sheltered workshops, where people were either paid by the hour or by the piece, often, and notoriously for pennies on the dollar. So the Workforce Innovation and Opportunity Act sought to curtail what's known as the school to workshop pipeline without actually being able to eliminate some of the mechanisms that allow that pipeline to exist. So it also prohibited agreements between schools and sub-minimum wage certificate holders. So schools could no longer contract with holders of those types of sub-minimum wage certificates to provide services for them, even if it was not a service related to sub-minimum wage employment. So that was something that was pretty impactful. So on this slide is the definition of competitive integrated employment under WIOA. And again, this is the first time that there has been a statutory definition of CIE, and it's been a little bit controversial, which I'll talk about in a moment. So there was some rumblings under the Trump administration that they may try to reopen this definition. They were going to, they had done a notice, they had put it out for comment, and they were thinking about doing additional rulemaking and possibly revising this. But so now under the Biden administration, that's on hold for the time being. But the definition basically says that an employment outcome for the purposes of the VR program, so that's vocational rehabilitation services, the setting has to be typically found in the community. In other words, it can't be a contrived setting for the purposes of employment experience. It has to be a place where an employee with a disability interacts with other employees within the work unit and the entire work site, and as appropriate, other persons like customers or vendors who are not individuals with disabilities. And that can't include supervisory personnel or people who provide services. So in other words, if there's an enclave and the supervisors don't have disabilities, that does not count in terms of meeting the definition of competitive integrated employment. So they have to interact to the same extent that employees who are not individuals with disabilities, who are in comparable positions, interact with people without disabilities. So that is the statutory definition. So in terms of things that are impactful right now, there are a lot of different policies that impact both settings and wages for people with disabilities. Unfortunately, they remain sort of two separate issues. So there's no one piece of legislation that effectively deals with both. So we have the Olmstead decision, which most people are familiar with. It was a Title II case back in 1999. And the gist of it is that Olmstead ruled that people with disabilities should be allowed to receive services and supports in the community setting of their choice. And that should be as integrated as possible for the nature of the support needed. There is an effort from the Centers for Medicare and Medicaid Services to promulgate new rules for the home and community-based services waiver. These rules have been pending for years. They keep getting kicked down the road, but as of right now, supposedly these rules are going to come out in 2023. They will be effective, I should say, in 2023. And those rules establish for the first time that an integrated setting standards for employment supports that are funded by the HCBS waiver. This will, when it comes out, is going to potentially be really impactful to a lot of agencies whose services are currently not designed to meet those integration standards. WIOA, the definition of CIE that I just shared with you, impacts vocational rehabilitation services in that people are not considered successfully closed into employment, or in VR parlance, a status 26, unless that employment meets that definition that I read on the previous slide of competitive integrated employment. Now that was impactful because a lot of agencies were sort of double dipping, especially a lot of agencies that had these Source America or niche contracts, which I'm not going to go into too much right now, but had these sort of federal set aside contracts that people were working on in workshop style settings. Sometimes if they were making over minimum wage, they were able to count that, quote unquote, as a closure into employment for the purposes of VR as well. And that no longer is the case under the new definition. So in terms of wages, the Fair Labor Standards Act 14C still exists. It is still legal to apply for a certificate and pay people with disabilities less than the minimum wage. Although I will say, thankfully, that this model of service has been on the decline for many years. It still does exist. I am not 100% certain of the status of the workshop at Challenge, but one of the questions we certainly have for any new employment partners coming into the county is the status of sub-minimum wage employment within their agencies. And then again, we have WIOA section 511, which limits but does not eliminate sub-minimum wages, which means there's still a loophole, and the school to workshop pipeline is not completely closed, even though there have been some efforts to mitigate it. So I will say there are a lot of pieces of pending legislation at the federal level right now. I predict that before the end of Joe Biden's first term, the Fair Labor Standards Act will be amended to eliminate 14C. It's been on the cusp of happening for years under multiple administrations, and it seems like the time is right, and I'm guessing it will happen within the next year or two. So obviously there's a lot there. It's a lot to unpack. But the main thing to know is that there are contradictions built into the system right now. And those contradictions create loopholes so that even though ideally we should be providing all people with disabilities opportunities to be competitively and integratedly employed as they are able, the fact that Fair Labor Standards still has section 14C creates some tension within the system. So many regulations tell you that you can't provide employment supports in certain ways, but then there are these loopholes. So what that really sets up and kind of brings us, I think, to one of my main points that I wanted to make tonight is that really sets up a situation where we have competing policy agendas. So on the one hand, we have the notion and the philosophy and the rules and regulations designed to make competitive integrated employment an option for everyone. And then on the other hand, we have a contingent where, and there is a nationwide, there's a contingent of mostly agencies that have banded together to advocate for sub-minimum wage and segregated employment as a quote unquote choice, that it should be every individual's choice to be able to choose sub-minimum wage sheltered employment or another non-integrated type of employment support if they want to. At issue here is the concept of informed choice. So one of the other things that WIOA did was under section 511, it requires that state VR agencies go into agencies that still have contracts under 14C to pay sub-minimum wages, and they have to do counseling to those people who are employed there on a regular basis to let them know that they have options. Unfortunately, that's not always executed very well. I know that here in New York State, a colleague of mine did a little study a few years ago and timed that counseling at 2 minutes per individual. So really, a person with a disability may have a very difficult time making an informed choice about whether or not they want to try community employment because it's something that they haven't experienced and they really don't have enough information often to make that choice. So that said, there are a lot of organizations in New York State and across the country who are innovating. As I said, this has been a time of great change, even though the needle hasn't moved as much as we would like to see it move in terms of employment of people with disabilities. There has been so much innovation even over the last 10 years. So one of the things that a lot of organizations are doing that are more progressive organizations is they're working with the workforce development system to design accessible career pathway and training programs. So career pathway and training programs in the workforce development system are job-driven and industry-driven, which means that they often result in jobs that are in middle skills occupations that don't require college degrees. They also pay often really good middle-class wages. And so another premise, that we have to sort of accept that may be new, a new idea for some of us, is that it's not a foregone conclusion that people with disabilities always have to be poor. And they often are. And I think that's something that we've just sort of accepted as a society without giving it too much thought. But really, the workforce development can be the pathway to a good job in the community for a good wage. And so there's a lot of agencies working there to make sure that job seekers with disabilities are included. A lot of agencies are working on partnerships with businesses to train people for in-demand roles. So for example, if you have, a casino locally, and that casino has a particular position that they just can't keep filled. They're just it's a revolving door. Maybe a local agency would develop a partnership with that casino where the business in that case would actually chip in to fund the service, and they would help to train people and provide candidates for those in-demand roles and then support them to remain on the job. There's a lot of collaborating with schools going on to create job-driven work-based learning opportunities to make sure that the experiences that kids have while they're still in school are as integrated as possible and as individualized as possible. There are some examples of profitable integrated social enterprises that pay industry scale wages as an alternative to workshops. I find those to be few and far between. But there are a couple of famous examples. So I believe it's in Connecticut. There's a movie theater that is completely operated by an agency. And to my knowledge, it is integrated and it is profitable. But as as we've learned here in Tompkins County, those can sometimes be difficult to stand up and to make them profitable and make them integrated. So embedding support personnel within businesses in disability liaison roles is something that I've seen more often recently. So for example, in Pennsylvania, the Giant Eagle Corporation has a relationship with a group of agencies that are funded in part by the United Way. And what they do is they pool their resources to fund these positions within grocery stores within the Giant Eagle chain to be disability liaisons. And those liaisons are technically employed by the agency, but they're embedded in the business. So they are the point person for all things disability within the agency or within the business, not just those individuals who are referred to them through a community-based agency for employment. So the other thing that, certainly I'm always encouraging agencies to do whenever I conduct a training is to partner more effectively with federal contractors. Federal contractors have affirmative action requirements in relation to employing a certain number of people with disabilities. And almost none, I think I could safely say none of them have really met what is considered an aspirational goal of employing 7% of their workforce as people with disabilities. And there are federal contractors all over the place. As a matter of fact, there are federal contractors right up in South Hill Business Park where Challenge operates. And so there are ways you can go to usaspending.gov and you can find your contractors and you can develop relationships, because what the contractors say is we can't find qualified people with disabilities. And the agencies are saying we can't find good jobs for people with disabilities. So really, those linkages can help to solve that problem. So those are some examples. And so I also thought if anybody's interested in learning more about why competitive integrated employment of people with disabilities is so important, I would highly recommend this article from the New York Times from back in 2014, The Boys in the Bunkhouse. Many of you may have heard about the case of the men who were working in a turkey processing plant for decades, being paid sub-minimum wages and living in abhorrent conditions. And the point being that unchecked exploitation really results in human suffering. And in this case, the $240 million verdict was the largest in EEOC history. And I'm not sure that all of that was awarded, but that was the verdict in favor of these gentlemen. And if you'd like some additional, I can send these slides to Karen to share with everybody. I've included a link to the New York State Employment First Commission's report if you're interested. There's a report from Congress. This report by Cheryl Bates Harris, Segregated and Exploited, she's updated it a couple of times. It really does provide a good and very, very well laid out overview of the history of employment supports. And then there's some more information about WIOA and its impact on competitive integrated employment, if anyone's interested. So I'll stop sharing. And I think we have a couple minutes. If anyone has any questions, I'll do my best to answer.
Any questions?
Do you have any ties at all with TSD BOCES here for training for these this level of people?
So the way that community colleges fit in is typically, well, I mean, of course they have their own.
TSD BOCES, this is not TC3.
Oh, TSD BOCES, I'm sorry, I heard TC3. So the BOCES would be where the career and technical education programs happen, the CTE programs. And CTE programs are typically, typically there's some type of partnership between a CTE program and the workforce development system, usually. So I'm not quite familiar with the process here, but a CTE is usually considered part of that continuum of career pathway. And in a career pathway, these types of credentials would be stackable and portable. So that, for example, if I'm a student at BOCES, I could graduate with, some type of CTE pathway, and then I could go to the workforce development system with that credential and maybe add another on top of it. And that's all of that career pathway continuum. It's part of that.
So there is training available for these people. So
the thing about CTE is that even though they are required to include students with disabilities, they don't always do it. So for example, there's certain CTE programs that have GPA requirements. And so that rules some students with disabilities out right off the top. Although I always say that that actually should be negotiated as a reasonable accommodation for students with disabilities. But yes, I mean, a student with a disability is a student first. And all students with disabilities are general ed students first. And so they should theoretically have access to high quality career and technical education programs through the BOCES.
Well, the reason I asked this is because I taught adult basic education at BOCES for 10 years. It was about 30 years ago, but we had a very successful program that worked out nicely for a large variety of people. And I was just curious to know whether that same kind of system exists today, because
well, exactly, and
great people. I tell you, they're wonderful.
It does, and so that's really a great point. Is that CTE programs do result in really good outcomes, but students with disabilities have often been excluded from those opportunities. Yeah. I know there are some states, like in Nevada, for example, they have really innovative partnerships with their state VR. In their CTE programs, so that VR and CTE have worked together to fund positions to support students with disabilities through those programs. So there has been some creativity around, trying to make sure students have access.
We were successful in getting people who were dyslexic with
Mhm.
jobs. And it was great because they were not dumb by any chance. They just were a little dyslexic. They had a little disability that we could overcome by some education and get around the statutes that existed then and get them good jobs, and it worked out fine.
Well, and in all of these areas, there should be an opportunity to explore reasonable accommodation for people with any type of disability.
Oh, yeah.
And I can give you a specific example. A certain Ivy League university that shall remain unnamed, had a training program where they had a participant who was blind. And that participant made it all the way through. It was like some hazardous materials removal training program or something. And that participant made it all the way through with flying colors, the classroom portion of the certification. But then, the instructors sort of balked in the end, like, how can I make this person who has, I don't think the person was, I think they had some vision. How can I make this person who is legally blind certified to do this type of hazardous waste removal? And so, we work with them to help them understand, well, first of all, if this person met all the other qualifications, they're qualified. And then you just have to work on what type of reasonable accommodation, could you provide? And in the end, long story short, that person ended up being really, really good at it, and did get certified. So sometimes people have a very limited expectations of people with disabilities. People with disabilities, even very significant disabilities, are often capable of working at a capacity and in occupations that people don't always encourage because they have such lowered expectations for them.
Yeah, I taught a couple of blind guys how to do CPR, and it was wonderful. When they caught on, it was bingo, off they went. So it's amazing what they can learn given the opportunity, guided and cudgeled, and gather them together and say, this is what we're going to do, and they do it. It's wonderful.
Yeah, I mean, people with disabilities are different and have different abilities, just like everybody.
Yeah.
Khaki, were you trying to ask a question?
Well, no, I just wanted to note that CTE programs and ABE programs are really two very different tracks. Sometimes a student may have needs in both of those, but like, and at TC3, about half of the different programs fit within a CTE classification. And may include students who also have developmental classes or not, but
oh yeah, I've been exposed to quite a few of them, so.
Any other questions? Elise, I'm hearing that competitive integrated employment is best practice. That's where things are heading in the field. Is that?
Well, I mean, competitive integrated employment has been the standard for decades. It's just that it hasn't always been realized, because as much as the philosophies have advanced over the years, the funding mechanisms and the rules and regulations didn't keep pace. And so there was a real disincentive for agencies to innovate for a really long time. But now that's starting to change. Over the past maybe 5 to 6 years, the momentum has really picked up. And so I think we're going to see a lot more change in that arena. Paula, did you have your hand up?
It got answered.
Okay.
Thank you so much for this information. It was really helpful. Gives us a good foundation. Great.
No problem.
Beth has her hand up, Mary.
Oh.
Whoops. Beth.
Thank you. I'm wondering if there has been a plan in place or efforts made to provide protections for peer advocates. We see more and more peer advocates employed and using their expertise. They are experts in their lives and in the ways that they facilitate care and services. So I worry about this becoming a labor force that becomes like an adjunct rather than really good at what they do and supported in that. And we're encouraging a lot of the training for peer advocates here. So are there efforts to provide protections for them in our community, in their workforce?
That's interesting. I mean, peer advocates are, I mean, I think you're talking about paid peer advocates, right? So
Yes.
paid peer advocates are employees and therefore recipients of all of the benefits and privileges of employment. And what agencies would need to be careful of then is not stratifying classes by disability, classes of employees by disability type, because you could run afoul of the ADA pretty quickly doing that.
Okay.
So, you know, I think that's just an important thing for HR departments to consider. They have to make sure that they don't create a second class citizenry of employees, because they could definitely run afoul of the ADA.
Thank you.
All right. Well, thanks again, Elise. Any
Sure.
other, not missing any hands? Okay. Thank you.
All right.
So we'll move on to our next agenda item, and it looks like Harmony's going to give us an update.
Thanks, Mary. I had to find my notes because I wrote so many. That was really informative. Thank you, Elise. Just a couple of quick updates. Working on the community services plan, the developmental disabilities subcommittee met twice now. So they're the leader of the pack. I think they came up with some really good ideas of what our focus should be on right now and going forward in 2022. But the mental health subcommittee will be meeting very soon to also start their process. And then I'll be working with the subcommittee for substance use services so that we have all of that feedback. I'm also going to hold at least one focus group. And Beth has said that she would make sure that that gets announced publicly, as well as just a few personal interviews with I feel some people in the community have a lot of information that they might not necessarily feel comfortable sharing in a large group setting. So people with unique knowledge of the community, I'm doing some personal interviews. So I'm hoping to wrap up by the end of May all of the data collection around community voice. And that will then get integrated with just more quantitative information on our community needs to put that plan together and then have it for the full board to review. And just a few updates on the mental health clinic and the PROS program. We're gradually continuing our reopening process. Unlike when everyone closed and it was like, boom, overnight we closed. The reopening tends to go a little bit slower, but we will be having open access at the mental health clinic from 11 to 1 starting May 17 on 3 days. It's 2 days now, but it will be Monday, Wednesday, and Friday starting on May 17th. And PROS has reopened 1 day a week in person, and they were really excited about the number of people who turned out in person. Heather, who's the PROS director, ran a class herself at 9 a.m. and she got 10 people. And she said, I never get 10 people at 9 a.m. So they're really happy to see the number of people that are coming out in person, and just, you know, gradually figuring out how to do all that, given our space limitations and all of the ways that we still need to continue to be safe. Also just wanted to highlight, I thought one thing I might be able to do is highlight different things that are different focuses for this OMH that might be helpful for people or other services as I get information from them. So OMH has been listening to community voice across the state, and I met virtually with them on Friday, and we were talking about services for children. They're recognizing that a lot of our case management services, children and family treatment and support services, and home and community-based services have really not had the uptake that they had anticipated, and they are seeing an increase in children ending up in higher levels of care. So they're really going to focus on that with some of this revenue they anticipate seeing coming out from the federal government. That was one of the things that they were talking about. And we're also seeing a number of children being referred to the clinic, so mostly in primary grade levels. So that's a trend that we'll continue to monitor, but something to make you aware of. And that's it.
Any questions for Harmony? Larry?
Not a question, but just to mention, and Harmony can talk about this a little bit. The Suicide Prevention Coalition has restarted and is in the storming phase of organizational development. For those of you who remember, Sharon McDougall and a couple other people really energized, including people from the Sophie Fund, really energized the idea of developing a suicide prevention coalition. We adopted zero suicide as a policy in a bunch of different contexts in the county, and we were moving ahead very pretty effectively, and then COVID hit. So we've had, I think, 3 meetings. Some of the issues we're getting stuck on is what a lot of groups get stuck on, which is the diversity, the demographic diversity of the coalition itself, but we're working on that. And we're working out the issues of leadership and stuff like that as we go along. So it's happening. I don't know if you had anything else to say.
Yeah, I mean, I think I love what you said, Larry. It's definitely in the storming phase, but I'm hoping we're moving more to the next phase of working and getting some other things done. Well, norming. We're kind of in norming too. We're storming, norming. What is it?
Storming, norming, performing.
Norming, performing, and there's a, yeah.
Yeah.
We're not at performing yet, but I
reforming.
think we're getting closer to the norming phase. So we're figuring out how we want to structure the group. And one of the big focuses there has been on the sustainability so that we don't have people leaving positions and then we face this challenge again in the future. That's been a part of it, but it looks like we're getting closer at what that structure is going to look like. The mental health clinic will work. Corinne has been gracious enough to volunteer to help with the notes and setting up meetings and take some of that workload off of suicide prevention and crisis services was doing some of that. So that's nice to take some of that work off of them and also figure out who might be our good conveners for the service. And then we have like 3 work groups we're working on. One is the strategic plan to finish that work that was started and figure out the zero suicide where everybody is right now. So I'll be working with Cuba Medical on that. I think they might be the farthest along of all of the agencies that had made a commitment. And then also on the diversity inclusion issues it's just being faced across the country and the state and trying to figure out what are some ways that we can make sure we're inviting and people can have diverse voices in our group. I believe we just identified that Buffalo's Suicide Prevention Coalition has a diversity committee and has been working on some activities. So we're hoping to steal some good ideas from them as well and bring those back. So a lot of work being done on that front. And so that's exciting to see that happen. I'm glad you brought that up, Larry.
Great, thank you. All right. Frank, can we turn to you for your report now?
Sure, thanks, Mary. Good evening, everyone. A few things to, excuse me, update the board on. Many have probably heard by now that Jason Molino, the county administrator, has told the legislature that he'll be leaving. So I think he's with us physically through the month of May, and then there'll be some transition time, I think, with whoever's appointed as the interim county administrator while he transitions to his new role. Certainly sad to see him go. He's done a great job as the county administrator these last 3 years, but he's been pretty public about his need to make change for his family and to be able to be around and supporting them more. So we're sad to see him go. I know the legislature is working on first appointing an interim and then I'm sure doing a robust search as they always do in these processes to find the next county administrator. So just want everybody to be aware of that. The CARS, you may have seen in the last week or so that CARS has announced that they are forming an affiliation with Cuyahoga Health Systems. So CARS will continue to exist as CARS, but they will fall under the Cuyahoga Health System umbrella. Mainly seeing administrative and executive level type combination, taking advantage of insurance contracts that the hospital system has, their marketing systems that they have, really, you know, working towards maximizing the potential to improve and increase the reach of CARS services. So I know it came as probably came as a bit of a surprise, and you know, we've also had conversations about challenge and the things that are going on there. It becomes we just have to be understand and respectful that we're not always going to know up front. I know we want to be involved, and we want to make sure the decisions are made well and are in the best interest of the folks in our community, and we absolutely should do that wherever possible. But these conversations more often than not have non-disclosures attached to them, which means that the two organizations can't talk to anyone about it, particularly because it's delicate situations and you don't know where it's going to end up. And so if you're early in the conversations and word gets out, it can really make things difficult for both agencies. So again, I know being surprised is never how we want to find out about these things, but unfortunately, the nature of you know, these types of conversations lends themselves to confidentiality. I do think, in talking with both CARS and CHS, that they both see this as a benefit to both organizations. CARS getting the you know, added support that the health system is able to bring on some of those administrative levels, and the health systems bringing in the substance use services part of healthcare into their mix. So I think ultimately we'll see it be a positive for both organizations going forward. I don't know that SUD has met yet, but Jessica Jensen, the executive director of CARS, is prepared to talk as much as she can at the SUD committee to give some updates. And of course, we'll be watching and asking them to give us updates as we move forward. Strategic planning.
Jan?
Oh, I'm sorry. Somebody have a question?
Yeah, I just wondered if you, at this point, had an idea how the services will look different, or, I mean, what you described was relatively broad. So I'm just trying to picture how it will operate. Maybe it's too soon to know that. I don't know.
I think it's probably too soon to know for certain, Jan. The way that Jessica described it to me was really taking advantage of the administrative strengths that Cuyahoga Health Systems has, particularly insurance contracting, marketing, the couple of things that I mentioned, really the infrastructure, you know, that provides oversight for an organization. They have a pretty robust one at the health system that is more than CARS would ever be able to have on their own. So I think that's really where they see the benefit in this. As far as programming, I don't know that they went in expecting that there'll be any significant programming change, but I don't know that there's any guarantee of that, of course, when these things happen. But certainly if there's programming change, those are things that they should be reporting to the substance use subcommittee and working with us on.
Okay, thank you.
Larry?
Can you tell me what Cuyahoga Health Systems is? I mean, it would be nice at some point, I mean, I'm being serious even as I'm smiling and laughing, to have some kind of like general sense where all the pieces fit together, which basically spawned from Cuyahoga Medical Center, right? So it would just be nice to know. And does that mean that or do we know yet if that means that, for instance, the executive director of Cuba Health Systems will be the executive director of CARS? I mean, do we know what level of administrative stuff will be the responsibility of CHS? And will CARS be an entity after this collaboration?
I don't think we know the answers to any of that yet, nor do they. I know they were talking about what the boards would look like. That's always one of the first questions, right? When you have something like this happen, and they're not definitive on that yet in all of it. And, you know, Larry, I think what we can expect when we hear about these affiliations is they're a step on the path to merging, right? Yeah. Under the umbrella. And you asked a question about what is Cuyahoga Health Systems. It kind of, as far as I understand, it grew out of the acquisition or merging between CMC and Schuyler Hospital.
Right.
So Schuyler Hospital is under the Cuyahoga Health Systems banner. They still have their own CEO and president, or CEO of Schuyler Hospital. Dr. Stallone is the CEO and president of CHS and the CEO of CMC, I think is how it works. So it really is what we're seeing across the healthcare system is smaller to medium-sized independent health entities of any type are struggling to survive, just because the economy of scale that you reach in health systems, you can't achieve that on your own. I think, you know, from what is Cuyahoga Health Systems, you know, beyond the two hospitals, they obviously have the primary care focus of what they do, the convenient care part of their business. And I think, you know, generally they're looking to, you know, try to be holistic in the care that their system can provide, right? Because that's what you're competing with, is folks going to Rochester or Buffalo or New York City for that holistic care where you go into one system and they have all the different specialists and primary care and all the different things. So I think that's really what CHS envisions themselves for our region, is, you know, the health system that can provide the full scope of care, either here locally or through relationships with other entities within the region.
Thanks.
Sure. All right. So strategic planning, just wanted to give you an update. The senior leadership team has been meeting almost weekly for the last 3 weeks or so. We're trying to put the finishing touches on the first couple of cross-functional team charters. I think the two main priority areas that we're looking at to start with will be the simple way to explain it is getting to know each other, right? Because we want to integrate services, but if we don't know who each other are and what each other does, it's going to make it difficult to see, you know, across those lines that have been in place for many, many years. So that's going to be a big part. And then the other part is our identity. So we're putting together the charter for a team to be formed to work on first developing a plan on how we will create that new identity, and then ultimately be tasked with putting together and implementing the plan, and then making a recommendation to both boards and the legislature about what our new identity will be. So those are the two areas that we're focusing on right now, because they seem like they're fairly foundational in the strategic plan priorities that we have. And we are looking to maintain a relationship with the Batiste Group to help us through these first couple of committees, to kind of teach us a little bit about the structure and how they should work, and, you know, help us move them forward. Really teach us how to do it. So for the next time, we don't need to pay the expensive consultants anymore, because we've learned and we're able to, you know, kind of manage it on our own. So that's where we are. And it's exciting because I think probably this week we'll be sending out those charters to staff to begin to form the teams to start working on them. So that's exciting. We'll of course keep you guys updated as it moves along, and let you know how it's going. And then the last thing we wanted to make you guys aware of is some challenges we're having with the mobile crisis team. We started the mobile crisis team a few years ago with the thought that we would be going out on 1 or 2 calls a week, right? Based on the usage and the demand that we saw back then, we felt comfortable that we could sustainably absorb that into the department with on-call staff and on-call existing staff and make that work. What we've seen is a steady increase in the number of calls that we're getting. I think some of it is just demand in the community, but I think also as law enforcement has heard loud and clear from our community that they want an alternative, that our community wants an alternative response to people with mental health and substance use issues. Law enforcement's been calling on the mobile crisis team more as well. So what that's really done is created, it's overwhelmed the team to the point where we can't keep folks on the team for very long because they burn out because of the sheer volume. We've tried over the last, I guess it's 2 years now because we lost 2020, but we tried to implement a bit of a shift where we had one of our forensics counselors was assigned to doing mostly crisis work during the daytime so that the folks that were doing the nighttime weren't getting it, but those calls have increased. And so what we've come to is that at the end of this quarter, we don't have enough people willing to sign up to maintain the team after the end of June. So where we're at is Harmony is working with Sue Spicer and the folks on the team to look at what we think would be sustainable and what resources we would need to do that. And then we'll be bringing that to both you and the legislature to have conversation about what we want to do. I think the challenge that we're faced with is we're kind of in this middle ground where we've had all this conversation about public safety reform as we very much should have, and the actual implementation of what was discussed or proposed during those conversations. And so we're in this limbo of we want, and many of our community expects that this change is already occurring, and we haven't really implemented or developed the plan on how that change is going to be supported moving forward. So hopefully this will prompt some discussion on what we want as a community. I'd point out that the mobile crisis team is really only one piece of a bigger puzzle, right? I think what we've heard talked about, particularly during the public safety reform conversations, is we want people that have different training and not necessarily a law enforcement officer responding to some calls for help, whether it's a mental health or substance use call out in the community. And we don't have that. The mobile crisis team was not designed to be an alternative to law enforcement. It was designed to be responsive for people in crisis, those folks that are a risk to themselves or others, where having a counselor, a licensed social worker available to respond could help in having better outcomes for those individuals. So we need to evaluate what it is we actually want as a community, and then figure out what resources are necessary to actually meet that need. So there'll be a lot more to come on this. We absolutely recognize and want mobile crisis to be a part of the solution in our community. We're running out of people that are willing and able to do the level of work that needs to be done because the level of calls that we're getting at this point. So this is really just an awareness for you all that we're in this situation, and Harmony and the team are working on some options, and then we'll be bringing those forward to see what kind of solutions we can come up with.
Travis?
First, I just want to say how much respect and regard I have for that team and the work that they do. The acuity in our community has gone up so high, and I know one of the challenges has also been things like being filmed when you're responding and all kinds of things that are happening that make that kind of intervention more difficult. But Frank, the only question I had was the community solutions worker as it was proposed and I read about that was different from a police officer. That's not the term they used. A safety officer, community safety officer, I think was the other title. Those folks, as proposed, could perform this function. Correct?
I think that's still to be worked out. I think there is a continuum. The 945 capability is a big piece of what the mobile crisis team is able to do, and not just anyone can do that. So, you know, if that is the intent, that you have a group of people that are different than the mobile crisis team, and you want to incorporate that, you just have to make sure that those folks would be eligible and are appropriate to take those steps.
Understood. Thank you.
Yep.
Larry?
So historically, the department has for a very long time done all kinds of crisis outreach. It was after the deaths of Michael Padula and the woman who was in crisis, Deborah Stagg, that the department started to beef up its crisis response and tried to improve its relationship with IPD particularly, but also with other policing agencies. And so over time, the Emergency Outreach Service, the Crisis Response Team, and the Critical Incident Team, we've had places on those. And I think separate and apart from maybe not separate and apart from, but a little bit differently than the community stuff that's being envisioned by reimagining policing. I think we have to maintain a resource that can respond to people in crisis and can also be supportive of law enforcement when they need the specific mental health input, particularly around decisions to transport people. So it's in New York. In New York State, the mental health law is very complicated about who can do stuff and when they can do it. And I think we just need to be clear about what our role will be before reimagining starts to materialize and after. We have some chunks on the ground of reimagining because we have a unique role and a unique responsibility. We're very fortunate in this community that violent incidents between the police and people in mental health crisis there aren't a lot, but there are, I'm sure, very confusing and very upsetting responses that having somebody with mental health training and licensure is useful, and I think we need to maintain it.
Yeah, and just to be clear, the critical negotiation team or crisis negotiation team, what used to be CINT,
Yeah.
actually, I think they just changed the name today as well too. The sheriff and IPD announced some changes. We have a member that participates in that.
Yeah.
He's one of two social workers that split time on that team. That's actually added to some of the stress as well, because when he is
Yes.
On call for CINT, he's not allowed to be on call for mobile crisis, right? Because you can't be on call for both at the same time. And so that's that's added some stress to it as well. That's one less person that's been able to support the mobile crisis team. So I agree with you, Larry. We want this to continue. I just can't keep asking staff to do this in what quite frankly is just an unsustainable manner for them and their well-being here. So we're not giving up on it by any means, and we absolutely understand the importance, and we want to be part of the conversation as the public safety reform conversation continues. I just need those that are kind of leading that process to know the acuity of what's going on. Law enforcement have been saying it throughout this whole process, and I think now they very much need to hear from us as well about the impacts that it's had on our team. So yeah, we understand the importance, and we're very much committed. So we'll be having those conversations. And that's all that I have, Mary. I'm happy to answer any other questions anyone has. Oh, I think Beth had a couple questions in the chat. I'm sorry. Yeah, so Beth was asking about CIT training for law enforcement. There has been some that's happened in the past, but it hasn't been for every officer or deputy. There's been a couple of training sessions over the last few years that have been offered. I do know the sheriff is interested, and they've reached out to us as well. So I know that's on their agenda on wanting to, at least for the deputies. I don't know specifically for IPD, but I also don't believe I've heard of any specific additional resources yet that have been allocated for that particular effort.
All right. Well, our next agenda item is to go into executive session. So we need to have a motion for that. Travis, and a second from someone. Tom, thank you. All right, so I think Greg is.
Yeah, just give me one sec.
You need to state the reason that you're going into executive session, Mary,
Yes, it's
for the record.
all right. It is to discuss nominations for openings.
So Mary, are you ready to go?
Ready.
Hold on one second.
I paused the recording, Greg.